Afternoon. Welcome to the Public Outreach, Education, and Wellness Committee meeting today. I'm Dr. Ron Lewis. I'm the chair of the committee. I want to ask all of us on the tables here to turn off their cell phones or make them silent so we can avoid the feedback noise. You may notice board and committee members accessing their laptops during the meeting. They're using these laptops to access board information for the committee meeting in electronic format. This is an official business meeting of the Medical Board of California, and as such, disruptions of the board's business will not be tolerated. We have a designated time on the agenda for public comment, and I ask for public comment on each agenda item. I ask that you be respectful of the need to conduct the board's business, and should anyone disrupt the meeting, I will ask the person to conduct himself or herself in such a manner that permits the board to transact its business. This meeting will be available via teleconference, and individuals listening to the meeting by teleconference will have an opportunity to provide public comment and will be assisted by a moderator who will be facilitating the teleconferencing process. For those members of the public participating by the teleconference, you will please wait until the moderator has introduced you before you start your comments. To request to make a comment during the public comment period, press the *1 on your phone, and you will hear a tone indicating that you are in the queue for comment. If you change your mind and no longer wish to make a comment, go ahead and press the # sign. That'll cancel out your queue. Assistance is available through teleconferencing, and to have assistance, press the *0 key and someone will assist you. Now, each person will be limited to 3 minutes per agenda item. However, during agenda item number 2, which is called public comments not on the agenda, the board has limited the public comment period for individuals on the teleconference to 20 minutes. In addition, public comment from individuals here at the meeting will also be limited to a total of 20 minutes. After 20 minutes, no further comments will be accepted. During public comment on any other agenda item, 10 minutes will be allowed for comments from individuals on the teleconferencing line and also those in the audience. After 10 minutes, no further comments will be accepted. The business services staff will be assisting me with receiving the public comments via teleconference during this meeting. Excuse me. The board welcomes public comments on any agenda item, and it is the board's intent to ask for public comment prior to the board taking action on any agenda item. If for some reason I forget to ask for public comment on the agenda item and you wish to speak on that item, please raise your hand and you will be recognized. I would also like to request that all speakers complete a presenter slip, which is located in the back. And you will, so I can call you by name at the appropriate time, and the record of this meeting can be full and complete. However, this is completely voluntary. Please give the speaker slips to Ms. Toof down there. And she will come by and collect those from you, or you can walk up and give those to her. I'll do my best to call upon everyone who has supplied a slip and recognize those who also wish to make a last-minute comment. I want to remind all speakers to please stay on topic of the agenda item being discussed and keep your comments to 3 minutes or less. Now we will call roll. Ms. Toof, are you calling roll?
Yes. Dr. Hawkins?
Here.
Dr. Kraus?
Present.
Dr. Levine? Ms. Pines? Here. Mr. Serrano-Sewell? Here. Dr. Lewis?
Present.
We have a quorum.
We have a quorum. Thank you. First item the second item on the agenda after roll call is public comments on items not on the agenda. So, do I have any public comments on items not on the agenda? Okay. I'm getting a cough. Well, kind of.
Good afternoon, Geneviève Claverol.
Okay.
What can you do when a physician advertises himself as a specialist, but when you go to the breeze and check his education or background or licensure, you find out that he just have a general, practicing license. What can we do about it? And
I think Ms. Kirkmeyer can help you address that, right, later, after the meeting? You'll talk to, okay, thank you.
thank you.
Thank you very much for your comment. That one, anybody else would like to comment on that agenda item? Do we have anybody on the teleconference line wishing to comment?
Not at this time.
Not at this time, thank you. Okay, so anybody else? Nope, so we'll move on to the next agenda item. Is approval of minutes from the January 21st, 2016 Public Outreach, Education, and Wellness Committee meeting. Are there comments from any committee members on that agenda item, on the minutes? Anybody on my right? On my left? No? Okay. Are there comments or questions from the public on this agenda item, which is number 3? No? Are there any comments on the telephone?
Not at this time.
Okay. So we'll go into roll call on the minutes. So
Dr.
Ms.
Hawkins?
Yes.
Dr. Kraus?
Yes.
Ms. Pines? Mr. Serrano-Sewell?
We need a motion to approve. Need a motion to approve. My fault. Second. Now we can,
Dr. Hawkins?
Yes.
Dr. Kraus?
Aye.
Ms. Pines? Mr. Serrano-Sewell? Dr. Lewis?
yes. The motion is approved and the minutes are approved, so. Okay. Next item is the update and discussion of the public outreach plan, which is me. Oh. I have to get up for this. Yeah, that'll be fine. I think I can see. Have what? Oh, for you to have it? Okay. Okay. Last time, for those of you who were here last time, we talked about prioritizing the activities we have for public outreach. And many of you heard updates to the website and also what we were doing as far as reaching out to the public. I'm kind of facing both people, so I hope I don't want to have my back to people, but it's just the best I can do, so I have to apologize. Okay, so next slide. First, before we even go much further, we have to develop a tutorial for our website to get people up to speed on how to use our website. So we're going to develop a tutorial to get the public to understand how to look up a physician's license on the website and what that information means. So that should be completed by the July 2016 board meeting. And we're working with the Department of Consumer Affairs to develop that tutorial. Now, we talked about developing PSA or public service announcements that can be provided to media and other interested parties. And staff is working to develop those public service announcements with various people that are going to talk about the board's website, what the board does. And that completion date is expected by September of 2016. But we first need to develop, of course, the board website tutorial before we can do many of these activities. So the information that's going to be included about the board and its website will appear on various types of media, various types of flyers. And one area that we thought would reach a large number of people would have this information on utility bills. We all get utility bills from the gas company, from water company, from electric company, but it's very difficult in these companies because they're kind of semi-public and they have regulations about what can be provided. But we are working with a nurse practitioner from PG&E who's developing sort of a health program at PG&E, and she's very interested in putting this information in their brochures, and hopefully we'll get these on the utility bills of PG&E. So it's a small start. Hopefully other utility companies will adopt this. Now, a large number of large number of people are located in city employees, county employees, and state employees. And those of you who work for the various entities, get your pay stub. Sometimes we get things attached to our pay stub, things from, how to donate here and the IRS information and all that. So we're going to, we've got agreement from these different agencies to attach to the pay stub a checkup on your doctor's license information. And they're going to appear on all the warrants issued by the state controller's office. And you see it's like 440,000 individuals. A lot of people. Yeah. The next is working with the AARP, a huge membership, AARP. And they've agreed to provide board information at their various conferences and on their publications and on their website. And by December 2016, we're reaching out to the AARP both in Northern and Southern California, and we're waiting for a response, but they seem to be very receptive with providing this information to their members. Another area has a large number of members is our unions and our pension funds in California. And by this coming April, spring, summer, etc., we're going to have an article that is prepared for CalSTRS and the California State Retirees Organization to run information about the board and its website in their publications. That's 934,000 people in the target audience. Next area is different various other types of media. People have heard of iHeartRadio, NPR, Capital Public Radio, and so we're going to provide interviews to these various types of agencies, and we're going to interview board members will be called upon to provide their talent for this type of interview, and also some of our staff members to discuss the outreach campaign and provide public service announcements to these various media outlets. And by this coming end of the winter, December 2016, we expect to have this project at least initiated and probably hopefully have some of our information. You'll see them in these different entities. And so again, we have to get the public service announcement prepared before we can go out to these various groups. Now, another big group that has large contingencies, of course, is our legislative members in California, Congress, congressional members in California, and also local governments. Most of us subscribe to various websites for our congressmen or senators, and also various local government agencies, various city governments, and we hope to link into their newsletters to provide, again, information on the board's website, the Checkup on Your Doctor campaign. So in next week, various members of the medical board are going to be meeting one-on-one with various legislators, and we're going to talk to them about our campaign, about our public outreach campaign, and encourage them to provide this information to their constituents on their newsletters. Because most of us get once a month we get a newsletter from our assemblyman or state senator. So this should hopefully, after we speak with them next week, we'll start getting them to adopt this and put this in their future newsletters. That's it. So that's part of our phase 1 of our outreach program. And next time we'll give you more information, and we'll probably go into maybe phase 2 the next meeting. So. And then Kimberly has a couple more updates to add to this. Thank you.
Good afternoon. A couple of things that actually happened after Dr. Lewis and I and Ms. Simoes and Ms. Hawkinson had put this together. A couple of things happened, and so I wanted to bring that to your attention too. And Dr. Lewis had actually already talked about our information going in the California State Retiree, and each of you should have had a handout. I'm thinking that you received this, and it's also in the back. The article that ran is actually on page 8 there that you can see down here. And I think it looks really good. This went out to 34,000 individuals throughout the state. So that's our first actual release that we actually have that went out to everybody. And then, of course, the next will be going out on the pay stubs. One thing with the pay stubs that we're running into with some of the cities and the counties, and especially like in San Francisco when we've contacted them, is they're telling us that basically we do all direct deposit. So now I don't know if they then provide them a deposit slip, just like state, or not, but that's one thing that we're hearing from some of the entities that we're contacting. So we'll work with that and find other avenues for that. We did talk to the Sacramento City, and they actually would put messages into water bills. That was one thing, again, with the utility bills, it will cost us a little bit of money. It's about $500 plus some additional cost to that. So that might be something that we're looking into. And of course, we'd have to go through the approval process to get that approved, to move that forward. But I thought that was another good thing that we can possibly do. The San Francisco City and County actually has a wellness plan for their employees, and we actually spoke to them, and they're actually interested in two things. First, they'd like a speaker to come and talk to their employees, and then also possibly putting out our materials. So that's another thing that goes in line with our tasks up there. We also spoke with the Orange County Healthcare Agency, and they're planning an article on the campaign for their May issue of their employee newsletter and an email blast that will actually reach to 3,000 agency employees to alert them. So that's one other thing that kind of falls into our plan. And then the last thing is that the Contra Costa County actually said that they'll put their message on their cable TV bulletin board, where they can reach a much broader audience of county residents. So those were updates that came in just over the last couple days that I wanted to bring to everyone's attention as well. So we're doing everything that we can to spread the word about the medical board.
Excellent. Very good. That was a good update, just the last couple of days, too. That's very, very good. Thank you. Any comments from my fellow board members about this? Yes, Dr. Hawkins.
Well, it's a great start. I just wonder if we've developed ways to track how effective these communications are.
So there's kind of two ways that we're looking at this right now, and we're just starting the second way. The first way is obviously just measuring our hits to the website and see if those increase the more information that we get out. The other thing that we're doing, and we just started it on one of our brochures, I'll be talking about a little bit later, is we're putting a code, it's an IT issue, and so it's the QR code, I believe is how you do it, and when an individual goes into the website from that link, it looks like you're going straight into just a medical board link, but you're actually going into a link that says, this person got to this from this specific brochure. So that's what we're starting to target as well, so we can actually see which type of outreach is the most effective. So that's something we're working with our IT to do. And of course, that's again when they click on something. So if we put it out in a brochure and we email it out, they can click behind the scenes. It'll show that it went from that specific outreach.
Good. Any other comments from board members? No? Public comments on agenda item number 4. I have one in front of me from Genevieve.
Geneviève Clavrol. I have another suggestion. The Board of Supervisors of Los Angeles County serve 10 million people, and they meet on every Tuesday, and their meeting is rebroadcast the next Wednesday, and is a huge viewership. And I'm sure the supervisor will be very happy to endorse such a project, because they have been very concerned about information for the public. So I would highly recommend that. you do that, or I'd be glad to do it for you.
Thank you for the suggestion that, I think we just wrote that down. Thank you very much. Any other public comments here that I've missed? No? How about public comments on the telephone? Anybody? Oh, is there one
There are
coming up?
none at this time.
None on telephone? Okay. Do you have a comment on agenda item number 4? Did I apologize if did I get it? Hold on. Did I? I mean, it's fine. Go ahead. Oh, it does say 4. Oh, sorry. Thought it said 5. My fault. My eyesight.
Hello, my name is Marian Hollingsworth, and I'm here on behalf of the Consumers Union Safe Patient Project. I'd like to talk with you about your public outreach plan. Now, the board's public outreach plan should represent only the beginning of the efforts to make an impression on California patients and should continue to be expanded to new groups, especially to reach out to large employers, the Walmart, even Target, places that government ones that employ a lot of people. However, the plan is still not targeted to reach patients at the teachable moments. For example, brochures and electronic messages where healthcare is delivered, such as hospitals, outpatient surgery centers, and physician's office. And also the plan, you mentioned a little bit of social media, but if you would tweet out or have more people go for the email list to make full use of social media, internet platforms throughout which most consumers get their information today. For example, I just looked up today on Facebook, and there is a Facebook page for the San Diego Medical Board office. That office could maybe send out information about doctors in that particular area, as could others around the state. Regarding the Breeze program and the outreach plans for that, there have been some great improvements on the online information, but Breeze is still not very user-friendly as it could be. For example, the site is exceedingly slow. I don't know if you've been there recently, but it can take anywhere between 45 seconds and 75 seconds to actually get up to a doctor's profile. The Breeze website is quickly overwhelmed and often sends users to an error page. Physician records are not available unless one has the exact spelling, and sometimes doctors do use a different name on their license than they do with their patients, so that can make a difference in availability. One cannot search alphabetically within a city or county, so to find a doctor's name, one must scroll down or guess at the most likely page. And sometimes we found that current disciplines are not available on the doctor's Breeze page, but rather under public documents, and most people don't know to go there. So a doctor could be completely clear on his Breeze page, but still have some records available on public documents that most people don't know what to do. Now, we have directed these and a number of other concerns regarding the Breeze website to leadership at the Department of Consumer Affairs in the past, but they've made no commitment to make needed changes. We recommend that the medical board urge DCA leadership to address these Breeze barriers. And finally, the board's public outreach plan only focuses on directing patients towards finding their doctors. We recommend that the board include in all of its outreach efforts information that informs the patients that they can also go to the medical board to file a complaint. And finally, we do appreciate the fact that you have put out a brochure about the confusing statute of limitations law that governs the time frame during which patients must file a complaint. We think that's really great that you did that. And finally, we'd like to offer to be available when you do these interviews, possibly have one of the advocates come with you for some of the interviews so that we could also provide our perspective as well. So thank you very much.
Thank you for your comments, Ms. Hollingsworth. I have no further comments on agenda item number 4. I do? Oh, board member, there you go. There's another comment.
I'd like to thank our last speaker for those wonderful suggestions. I don't know if they've been forwarded to the board directly, but I, for one, would like to have a written copy of those suggestions if they can be made available.
Did I miss anybody else from the committee members? Okay. And I've already asked on the telephone. Let me ask again. Anybody else on the telephone?
Not at this time.
Okay, thank you very much. So we're moving on to agenda item number 5, which is the update and discussion of the Public Affairs Strategic Plan activities with Ms. Kirkmeyer and Ms. Mose.
So unfortunately, Miss Hawkinson was, actually has a family wedding, and so she was unable to make this board meeting. So we allowed her to take the time off. So Miss Simose and I are filling in for her today. So a lot of this is actually due to her work, but we're going to actually kind of go over some of it. We're not going to go over every item on the strategic plan. It's all right there in your written materials, but we would like to just point out a few of them that we think are important. And I think with that, I'll kick it off to Jennifer.
So like Kim said, we're just going to highlight some of the ones that we think are important. So starting with the first one, on September 17th, 2015, Ms. Kirkmeyer attended a general medical staff meeting at the Sonora Medical Center, and the subject was Bending the Curve, the Opioid Epidemic in Tuolumne County. And the presentation included educating physicians on the board's enforcement process and the new guidelines for prescribing controlled substances for pain.
And we're doing more of these regarding the controlled substance, the guidelines for prescribing controlled substances for pain, reaching out to hospitals and different physician groups, because that is in our outreach plan to really educate individuals on the laws and regulations in California, and that kind of does that. We actually also have one of our board members who's going to be doing that to a group in June, and then also Dr. Bishop and I will also be doing that later in this year. I think it's scheduled in November. I did find that when I went by myself, not being a clinician, I had questions that I actually couldn't answer, so I will be reaching out to the board members to help me as I go forward with those, because it's definitely things, some of the questions I can't answer, so it's really helpful to have one of the members there with us. The other one that we'd like to point out is that we actually have been doing a lot of the town halls, and we do those either with assembly members or we do them with other individuals. We're also looking at really doing some of the senior scam. And all of these individuals, when we target this audience, it seems to be a lot of the seniors that attend both the town halls and the scam stoppers that are put out there. So I know one of our groups really is to hit the seniors to kind of show them not only, look at our board's website, but for those that don't have it, we also provide our phone number. So that's another one we wanted to update you on.
And so going along with the prescription drug abuse issue, so in February of 2016, Ms. Hawkinson was a presenter speaker at the second annual Dose of Awareness 5K Walk and Health Expo in San Ramon. And this was held by the National Coalition Against Prescription Drug Abuse. And she just spoke on the importance of checking on your physician's license and how to file a complaint with the board.
Then another one that we wanted to bring to your attention is not only, we actually have a blurb in our newsletter that says if you would like somebody from the medical board to come make a presentation, to please contact us. We've had a lot of hits from that, actually. And one group, which we're really happy about, is the medical assistant group. So medical assistants, as most of you know, have a limited scope of practice. However, we find in some physician offices, they tend to get expanded beyond what they should be doing. And we get a lot of complaints for that. You've seen accusations for that. So Ms. Webb and I had the opportunity to go out and speak to a big group of medical assistants in Sacramento. And actually on the 21st, now they've asked us to come and do the same in Modesto. So that's a group. So it's expanding even beyond providing the laws and regs to physicians, but it's also to those other individuals who report to physicians. So we're excited about that outreach.
Okay, and another thing that we've kind of noticed is overall has been a really good thing for the board, and it was mentioned in earlier public comment, was Twitter. So we've actually seen that it's been a good way to get the information out on the board, and it's been really beneficial to the board to get that information on, everything, like what we're doing, media campaigns, meetings, and so it's been really a good way to just get the information out there, and we'll continue to use that Twitter as a tool to get information out to consumers and others.
And one thing that we haven't looked at is in regards to our Twitter account, but one thing we may not want to look at in the future is when we put together our first, I don't know if it was a plan that we put out for Twitter or, kind of a policy on our Twitter and what we would put out. We said we wouldn't put out disciplinary actions through the Twitter account. We've really left that to the email subscription. But I think that that might be something that this committee wants to consider in the future, is actually tweeting out when we actually take action against a physician, because it is public information. And again, we do use the email subscription, but not everybody is always subscribed to that. So we think that that might be another avenue for Twitter as well. Another thing that we're doing is we're actually, we found that our articles in our newsletter, for those of you that read our newsletter, we actually have a section that is called question and answer. I can't remember, you asked for it. And it's a section where we get questions from individuals through our webmaster account, and then we provide the responses in there so all of physicians and everybody that reads our newsletter know that. Well, what's interesting is, as of late, and there's actually the Santa Clara Medical Association's bulletin, the Merced Mariposa Medical Society, and the telehealth article, that was the article, and then the San Francisco Medical Society, they have a San Francisco Medicine. All of them have been republishing a lot of our articles. So we did one on cures that they republished, we did one on telehealth that's been republished, and then a lot of those, you asked for it, have been republished in all of these magazines. And so we think that that's another great benefit for those that read those magazines. Is that it? Okay. And then the last one that we wanted to bring to your attention is actually board member involvement. And that is in regards to Dr. Lewis. Dr. Lewis and I actually traveled to Fresno, and it was probably one of the best presentations I've ever attended. A lot of times, you go out and you speak and you kind of get, the stared looks at you out in the audience and everything. But this was a group of about 50 residents. They were family practice residents. And I brought up issues like, can you work for a layperson? And you saw blank stares in the audience. What if somebody comes to you and wants you to be a medical director of a medical spa? All of these things, and I think Dr. Lewis can even pitch in there too, we just found that a lot of information about the board's laws and regulations, just really at that level, they just don't know. And so I held up our Medical Practice Act and showed them the book and said, these are all the laws that you have to follow once you get your license. And I think it was kind of just like a shock to some of them. And so that was probably one of the best outreaches for physicians that we've had. We really went over a lot of the things that we see physicians getting into trouble for, a lot of the laws that are kind of obscure. And between Dr. Lewis and I, we kind of did a tag team show for them, and going back and forth. It was very interactive, and I think it was probably one of the greatest education presentations that I've been to.
I think we had Kimberly become the doctor, and I was asking her questions as the doctor. Can you, or what about, or I need a prescription, but I don't really want to see you. They had no idea, that these are issues that can come back and haunt you later. Had no idea, but I think we were invited by the family practice group, which is, we usually don't get invited by these residency groups to come and talk, and it was wonderful.
And so we're really going to do outreach to try to get more groups like that where we can get out to those individuals. And I think that covers everything, unless any of the members have questions specifically from the outreach report.
Thank you very much. Any more comments before I get to public comment from members of the committee? Left? No? Okay, I have two people who'd like to provide public comment. So Genevieve, did Genevieve just walk? Oh, there you are. Oh, it's all right. Yeah.
Geneviève Clavrol. I am very concerned. Right now, I'm seeing a lot of people like myself who are in pain management. We are having a lot of issue when we're trying to find a new physician. And when you don't know the physician and you are seeing them for the first time, asking for them to demand that you sign a pain contract is absurd. And what I'm finding out is that those physicians have already checked the cure system. And first of all, I don't think they should do that without they talk to you first. And I think we're going to see more and more of that patients are not receiving the care. Myself, because I refuse to sign that contract, and because I refuse to give a urine specimen because I have no feeling in my hands, so I requested a hat. Older women have a problem, and many times we need a hat. They did not have one. They refused to provide me with one. I offered to have somebody go to my house and bring one. I demanded to change physician. I was refused care because that physician on my medical record put down that I have refused to provide a urine specimen, I have refused to sign the pain contract, and I have demanded Percocet, which I never did. So I think, I'm not the only one it's happening to. And a person like myself, I had seen the same doctor for 10 years in pain management. He just lost his practice. That's why I had to change. But I have used the same pharmacy, the same doctor for 10 years. To say that I'm a drug seeking and put that on my medical record because they could not provide me, with equipment, I'm very concerned. Because, when I was involved with the medical board on a task force on drug, addiction, and I voiced my opinion about mandating signing the pain, contract on the first visit. That I think is very dangerous, and I think we're going to have a lot of repercussion. And personally, myself, I am going to report that physician. I think a physician who misrepresents the facts, falsifies the document, should not keep his license.
Thank you for your comment. I have Lisa McGivert for agenda item 5, right?
Good afternoon. I'm Lisa McGiffert with Consumers Union Safe Patient Project, and I just wanted to briefly comment in support of you considering to use Twitter to send out information about disciplined doctors and to include their names and their counties and a link to the action. I think this would go a long way to raise awareness in the public about the work that you do. And I recently looked up some information about how many people are on mobile phones, internet mobile phones, and we're at like 80%. So you really get to a broad array of the population, all income levels, all different groups of people are using mobile phones, so that might not ever know to sign up for your email list to get this kind of information. So I think that would be a really important step, and I hope that you will consider the recommendation to have a discussion about that. Thank you.
Thank you very much. Any comments on the telephone about agenda item 5?
Not at this time.
Okay. So I will then move to agenda item 6. Agenda item 6 is the update, discussion, possible future action on the enhancements to the website. Ms. Kirkmeyer.
I wanted to just first point out, we did put in under tab 6 there, the consumer reports that came out in the ranking for a survey and ranking of state medical and osteopathic board websites in 2015. I think that I had sent this out earlier, but I'm happy to report that the medical board came in as the top state in the nation for our website. And so I just wanted to put that in there and make sure that individuals read it. However, when I'm looking at this, there were a couple areas, 2 areas where we scored lower than obviously all of the other areas. And so I've been looking at trying to find ways to improve those 2 areas based on looking at the states that did better than us. And so although I don't know the actual specific reasons for us going lower, and I do have to talk to the individuals who put the report together to get those specifics, but I did just want to show a couple things that I'm recommending that we do for our website. So this is kind of difficult to see, so I apologize ahead of time, but this is our existing homepage, and I'm hoping I can show this over here. Okay, so from our existing homepage right now, once you click on this or this up here, license search, then it takes you to a page where you then have to choose what type of licensee that you want to look at. Obviously, out of all of our licensees, you know, we have 135,000 licensees who are physicians. That's our biggest licensing population. So that's usually where everybody's going to our webpage. So what I'm actually recommending is that we actually do a quick check from here. So basically, this says right here, quick physician name search. So rather than just having to go through those other steps, we would have this if an individual wants to just knows the name of their doctor, they want to go directly to be able to put in that person's name and to look that up. You would click on that, and then it will actually take you to the, whoops, I jumped ahead, to the name search box where you would normally find. So that's one improvement. Some other states go directly from their homepage to a physician name search, and so that's one thing we would like to do. The other one, and I am sorry you can't read this, and I actually can't read it either, but in here we had this is our existing web page, and I'm going to, Liz, can you read that for me, please? Whoops. Right there. I'm sorry. I didn't realize this was going to be so small on here. Basically, what this says is, you know, be aware that this information is available to you, and it talks a little bit about the physician profile. It's very bureaucratically written. So when I went and looked at the New York, actually they were one of the top ones, I looked at their web page, and they actually put it very clearly, like, here's where you can find information about your physician, here's where the profile is, and what this profile shows. It gives you information on the physician. So that's actually what I'm recommending that we do, is this actually has, thank you, Lisa. So what it says is, please be aware that the law authorizes the board to post certain information on the physician's profile indefinitely and other specified information for a limited period of time. See below link for specific information. It's very convoluted. It doesn't say what you're really looking at or anything. And so we're actually recommending that we make the changes to say, basically, this is where you go to get information on your doctor, and this is what the profile provides you. The other thing that we want to do is, because physicians are our largest group, if you look here, you can see that when you go into this page, when you click on this, you have to actually go through, you have to know to click on the physician and surgeon. So what we're also recommending is that when you first go to this page, this will already be opened. So you can look right down there, and then you can know to look up the physician by name, by their license number, county, everything else provided there. The other thing that we're doing is, one of the things that we actually have that a lot of other, not only states have, but also what other even boards under the Department of Consumer Affairs has, is this ability to search by the specialty of the physician, where they're located, their practice area. So all of that now, we're going to make that very plain English to where you can do that. So those are the changes that were going to be made. The other thing, before I get to this one, that we got hit on was the malpractice reporting. And we have specific laws that say what we can report for malpractice information. Well, unfortunately, when this report came out, the medical board didn't have that. That was one of the things that was under construction with Breeze. Right now, we were able, and we have all of the individuals who have malpractice settlements that fit into the criteria that has been provided by law. Those have now been put on the board's website. So I think if it was done over again, although we do have some disclaimers and everything that might be viewed negatively, we do now have the information on the individuals that have a malpractice settlement out there. And then this came up earlier during public comment, but this is the new flyer that we actually have. We're going to be providing this. A lot of individuals didn't know that there's a statute of limitations, and they sometimes would wait to send in their complaints, and then we'd find that there were issues with that. So we actually did a flyer. We actually worked with the Consumers Union Group on this together and had them review the wording and make sure it was clear. And we now have this done. It's actually going to be going into every complaint form that we actually send out, so individuals know to do this. And then when we also hear from third parties, such as a malpractice information, we also send this brochure to the individuals to tell them, hey, send the information in right away, because there is a statute of limitations. So those are some of the things in the web enhancements. And I apologize that it's not closer where you can see the enhancements there.
That's the end of your report, right? Okay, so on agenda item 6, I'm going to ask for any comments from the committee members here. Nothing to my right. I'm going to my left. Dr. Hawkins?
So I just wanted to actually really commend the Consumer Union and the Informed Patient Institute for this survey. It's actually very, very helpful. I did have an opportunity to read it before coming to the meeting. And as our executive director has already stated, she's already using that information to improve the ability to protect the public. The dialogue that's been occurring has also been extremely helpful. Thank you.
Any other comments? I have public comment from Yvonne Chung.
Good afternoon, Yvonne Chung with the California Medical Association. We just wanted to congratulate the board on their ranking in the Consumer Reports survey of state websites for medical boards. While we agree that there is always room for improvement, we have looked at other state websites and found that California is indeed far ahead of many other states, and I would also like to add that in comparison to many of the websites for other California state licensing boards, the medical board far and away provides much more information on their website and current information, I might add as well, than many of the other professions. And so I think that's something to be commended. Thank you.
Great, thank you very much for your comments. And I have one more from Lisa McGifford.
Hello, Lisa McGifford with Consumers Union Project, and I'm glad that you all got to look at the ratings, and I wanted to just kind of go over a few things, and it's very nice to see that Kim is responding to some of the issues that we raised, that sort of best practices around the country. So we really appreciate it, and we'll look forward to working with you. We're not going to quit bugging you about improving the site, but this was a comparative situation, and CMA and we agree on something here, that California comparatively has a lot better site. A lot of the other sites are really terrible, and we hope to raise them up. And we did this report with the idea that we would work with the boards around the country to help them improve and to show them what other states are doing. And it's true that you got high scores because you have a lot of information. That's one of the reasons that you stood out a lot more than other states. You provide links to your legal documents, which we encourage, and you have a lot of information for consumers about the board members and about how to file complaints, and the other thing that what Kim was talking about that will further facilitate, and something that most of the boards that have aggregate sites like Breeze don't have, that direct link to the doctor's list. Some of you have to pull down a list, and you get plumbers and massage therapists and everybody, and you have to wade through that. So that was held up as a best practice in our report. But here's some things that we think you could improve on. Kim's mentioned a few of them. You actually improved, while we were completing our report, one of the improvements we were asking for was that homepage simplification, look up a doctor. The board members saw that as a barrier, and we did too, instead of verify a license, and that was already provided. You don't have information about residency programs or federal action, links to federal actions. That's one place where you had points taken off, and same with the medical malpractice, which is a legal issue. It has to probably change the law to put all medical malpractice payouts out there. We'd like to see information about complaints, because you can't really know if a board's doing their job unless you see what's coming in the door. If there was a way for you to document the kinds of complaints that you're getting. And finally, we want to see plain language summaries on the on the profile, and some of that is included in Senate Bill 1033, but right now, a consumer has to literally scroll all the way to the bottom and read a bunch of legal papers to figure out why the doctor's on probation. So we look forward to working with you on further improvements, and we will continue showing that a state can do these things if they're really committed to it. So we appreciate all your work and look forward to working with you.
Thank you very much for your comments. And now I'll go to the telephone, if there's any comments on the telephone.
And not at this time.
Not this time? Okay. We don't need any action from the board, so we're fine. So that'll conclude agenda item number 6. Agenda item number 7 is future agenda items for the next meeting. Do any committee members here have any future agenda items they'd like to put on for a future meeting? No? None? Anybody, any public comments? I don't have any here in front of me. Anybody I missed for public comments? No? And on the telephone, any public comments on the telephone about agenda item number 7?
No, sir, not at this time.
Okay, seeing none, seeing no further business needs to be conducted, I'll now adjourn the meeting. Thank you very much.